So absolutely, I'm very familiar with them, particularly the WHO one that we've been involved with, and a number of ones. ECDC has a very good one. There are a number of others. Our Special Advisory Committee nationally has been looking at this and addressing this issue about how do we make this relevant to where we are in our pandemic here in BC and across Canada. So we're at different places in different parts of the world, and certainly even in different parts of Canada. So there are things in there that are very relevant and that we've talked about them. You know, how many cases we have, how much our healthcare system has capacity to contract or expand, our PPE supply, and how secure we are with access to it in the longer term. In the community, you know, how secure we are with our testing capacity, which has been, as we have reported here in BC, we've increased our testing capacity. I think the other piece that's really important around our testing capacity is having access in all parts of the province. And once again, within BC, we're not at the same point in all parts of BC either. And also having access to a serology test that helps us understand who has been exposed and who has been infected and who has some immunity to this would help us guide our direction. So those are all the things that we are also considering, and we are developing our roadmap both for how we will look at the healthcare sector, but also how we will look at measures that we need to continue and what we can lift within our community. So on Friday, we'll talk some more about where we are in our pandemic and how that might be reflected. And then in the coming weeks, the planning that we're doing now will be available, and we'll be sharing it with everybody as well. But I think it's really important to recognize that we are not at the end of our beginning yet. We're maybe partway through it. We're not at anywhere near the end of what we're going to do with this, and normal is going to look quite different for some time. It's not going to be the same as what it is today, perhaps, but there are some measures that we are not going to be able to stop doing until we have enough immunity in our community, what we call herd immunity in public health, until we have enough to prevent transmission and prevent lots of people becoming sick in a very rapid way. So that is the important part, and part of that is understanding who has immunity already, and the other part of it is the ways that we increase community immunity is either from people being infected and surviving, or vaccine. So those are two really important pieces that we need to consider, and we'll be talking more about that on Friday. Bigger international questions, those are challenging ones, and I do have great concerns about things going back to so-called normal when we know the amount of destruction and suffering that this has caused around the world. And I can't even begin to think that we would allow that sort of return to a practice that puts people at risk again. And it's not only putting the rest of the world at risk, but putting people in those communities and in China, for example, at risk too. We are not yet through this pandemic, either here in BC, in Canada, or globally. And there's a lot of work that still needs to be done to understand how we can get through this safely. So here in BC, we'll be looking at making sure we have that we continue to have our safe distance measures in place, our hand washing, those things that I just mentioned. And how can we reopen those critical services that we need in our community, those businesses, our economics, without losing that safety distance? But also connect our communities again and continue to connect in communities. We'll also be looking at the health system. So how do we restart those pieces of the health system that we have put on hold for a while, but do it in a way that's safe? And part of that will mean having the adequate testing that we need in our community, and we're getting there with that. Having things like serologic testing to help support us in investigation, having public health on the ground to investigate every single case and make sure that we stop those chains of transmission so we don't get explosive outbreaks like we've seen in other parts of the world. So those are the critical things. We need to find that balance, the balance between opening up, letting us get back to some of the important things that we have in our lives, including our health system, but being prepared that if we start to see cases, we start to see a surge again, we're able to manage that effectively and protect people, both who have the disease and those who are in our communities that need healthcare for other reasons. So it's the details are things we're working out right now, but it's going to be a fine balance, and it's going to be a learning experience. We're learning from watching what others are doing who are farther ahead of us in their trajectory, and we'll continue to follow that over the coming weeks. The short answer is absolutely. We've said before, and we'll continue to say, what we're thinking about is at the after the end of April. I don't foresee any changes to what we're doing in the coming 2 weeks, 3 weeks. But in the meantime, we're still planning for what we can do once we start to get to that point where we're tipping over the edge, where the curve is not just flat, but it's come down. We're not there yet. We still need to hold the line. Really importantly, we need to hold the line for the coming weeks here in British Columbia. We are doing okay. And we're seeing that in the fact that people get the health care that they need. People are able to manage in our communities. And that's why it is so important for us to be patient right now, to be kind to each other, because it is going to be some weeks before we can let up even a little bit.